Hi, thanks for tuning back in. I'm Paul Chartier. Joey Maggard is still here, and Dr. Campbell from UK Healthcare has joined us. Thank you.
My pleasure.
Joey, talk about the relationship between the Heart Association and UK Healthcare.
It's a very strong relationship, and we had spoken just a moment ago about the Go Red for Women movement in Kentucky One St. Joseph. Along those same lines, UK Healthcare sponsors a program for us called My Heart, My Life, which is really a physical activity, nutrition, education program to encourage people to move more and eat a little bit better. It really has been, through the years, corporate focused, and as a result of that, we have 16 companies here in Central Kentucky who are recognized by the Heart Association as being fit-friendly companies, meaning they are really looking out for their employees and trying to do the right thing by providing better snacks, by providing walking breaks, by having no smoking. Of course, that would be every employer here in Lexington, but really looking at those kind of things to create a healthier environment. Our partners at UK Healthcare help us along those lines by doing some lunch and learns out in those corporate settings, by doing some lunch and learns in civic settings with civic groups and that kind of thing. And it's a very, very strong relationship, and we appreciate their support very much.
In the first segment, we talked about people going to the website and trying to investigate, trying to find information out about heart health. From your side, as a doctor, what should people be doing to take care of their heart?
I think it's very simple. I think it's a question of improving your diet, a diet that's rich in fruits and vegetables, a little lower in calories. It's a question of vigorous exercise 3 to 5 times a week, and that'll make a huge difference. Targeting weight loss, all those 3 things. They're at your fingertips. They're available. They don't cost anything, and they can make all the difference. When we look at societies where they're more active and they eat a more plant-based, plant-rich diet, they just have fewer heart attacks.
Well, we're talking about Kentuckians.
Hey, we can do it. We can grow this food right here in town, and it's at the farmers markets. It's more and more often in our grocery stores. Vast improvement in the cafeterias at the hospital and other places. So it's becoming easier. There are more and more people that are aware of this.
We can cheat once in a while,
Right.
but that should not become the norm.
Right. Everybody, you get to splurge and have some fun and all that. All that's great, but the norm should be sort of a plant-rich diet, not excluding anything, but very, very high in plants and green vegetables, and exercise.
How much of heart concern and heart disease is hereditary?
There's a significant proportion, but when you really get down to it, even if you have of most of the patients that I see who have a hereditary component of their heart disease, they've also done very little in their lifestyle to prevent this event. So we really don't even know what would happen if someone who had sort of one of those backgrounds that left them predisposed to cardiovascular disease would do if they took a really aggressive approach to fending it off with lifestyle.
We hear the word heart disease. What does that mean?
Well, the heart disease that we're talking about with most often in this context is coronary artery disease. This is a blockage of a coronary artery that can come on slowly and give you chest pain with exertion, or can come on fairly quickly and cause a heart attack. And it's the same process that causes most of our strokes as well, and can cause pain in your legs. So it's a disease of all of your arteries, and it's caused by the same sorts of things: tobacco use, a sedentary lifestyle, a high-fat diet, a diet rich in processed carbohydrates. These sorts of things will lead you that direction.
And you're saying by taking that muscle and exercising it and making it work harder and pumping that blood through, what's the relationship between exercise and
Great question.
health?
So you're not just protecting the heart by keeping it fit. That's part of it. You're also utilizing nutrients in a better way, so the rest of your muscles and the rest of your arteries are healthy. You're burning calories that keeps the amount of work that your heart has to do to a minimum, and you're turning on all kinds of sort of hormonal and other sorts of pathways that are good for your health. You're fighting off diabetes, you're fighting off high blood pressure. Those are things that that contribute to heart disease, and so those kinds of things can be treated. In fact, some people say that if you can drop your weight by 10 pounds, you may come off of one blood pressure medicine. and you start to add exercise and a really healthy diet, and you start to see the medicines that you take go away.
And I've talked to people that lost a lot of weight, and they had 7 maladies be reduced or
Right.
go away because of working out on a regular basis.
Absolutely. Diabetes, sleep apnea, hypertension,
Sleep apnea,
all of these
yeah.
things are things that you can get a handle on with diet and exercise.
You talked about smoking.
Right.
What does that do into our heart?
There's no upside to tobacco use.
Yeah.
It has short-term effects. such
Now
as,
wait a minute. It makes your clothes smell. It makes you cough more. It makes the people around you smell. What do you mean there's no upside to it?
No, if those are important to you, I guess you can get those things. But there's a short-term effect. In the short run, just being exposed to tobacco can cause your arteries to become more active and tend to spasm. Then in the long term, it just sets you up for atherosclerosis or blockages in your arteries, and makes them more prone to rupture and cause heart attacks or strokes. So there's really not any way around it. We've got to do better with tobacco in the state of Kentucky.
To try to, and my mom smoked, and we all know people that smoke, to try to take that mindset of the high they get from the nicotine, try to project it of laying in a hospital bed with tubes and I mean, we've seen the commercials, people coughing, and is that nicotine worth it?
Well,
It's not easy to get off of it.
it's not. And I don't judge folks
Right.
that smoke. It's
Right.
it's a difficult
Yep.
addiction. It's
Yep.
one of the most difficult things I do in my clinic is trying to help people beat this addiction. Even very motivated people find it very challenging to win this battle. So we try lots of things. There's various medications and nicotine replacement therapy and things like that we do to try and help people stop
Right.
smoking.
Yep.
For the rest of us that don't smoke, the anti-smoking laws and smoke-free environments are good for our health. In communities where restaurants are smoke-free, there are fewer heart attacks. And so we need to support this sort of legislation just to reduce the effect of secondhand smoke on the rest of us. So when I'm trying to help somebody quit smoking, I say, first things first, don't smoke inside. Second, clean your clothes, clean the drapes, clean the paraphernalia of tobacco out of your house. So that when you're going to smoke, it's an outside activity. Then you're not affecting anyone else in the home, and you're starting to discipline yourself around smoking. Then we talk about nicotine replacement therapies, and they seem to be very helpful in some cases. And then, there's a good old-fashioned willpower.
The relationship between women and heart disease and African American women and heart disease.
So there are a lot of things that we're learning about this. First of all, women don't tend to present exactly in the same way that men do. And a lot of our therapies and our algorithms and, go to the hospital if this happens, those things were sort of devised in an era when most of our evidence was regarding men. So women may not have classic symptoms. They very often do, but you may find that nausea and lightheadedness and dizziness and things like that are more prevalent than frank chest pain. So we've got to get women to understand they've got to come in and be seen because the disease presents a little differently. But as far as the risk factors go, we find that they're prevalent in women. The same sort of pathology that occurs in men is going on. There's a little bit of protection from heart disease by estrogen and being female. But once women go through menopause, then this disease starts to present itself. Additionally, in the state of Kentucky, where we have so much tobacco use, we see very young women have heart attacks, much like the woman who was in the video that we saw earlier. That woman is not too young to have a heart attack in the state of Kentucky if she's a smoker. And so people just have to be aware of this. With respect to the African American community, we find that there's a high incidence of high blood pressure and some of these other risk factors that lead people toward heart disease.
Untreated.
Untreated hypertension, that's right.
Yeah.
And so, the first step is get seen, get treated, know your numbers,
Right.
and start working toward improving them.
How is someone going to know that they have a heart attack? And from that first sign, what do they do?
I'm going to let you take the medical side of that,
Right.
but they're going to know is what I'm going to tell you. They're going to feel that presenting pain, and in most instances. I think that you'll see some variances, and again, I'll let you speak to that. But what we'll get to is calling 911 as soon as you can.
Yep. I would rather have them make a dry run
Absolutely.
Yeah.
than say,
Absolutely.
it's nothing. And
I will say this, you know, the emergency departments in the state of Kentucky are excellent at screening people and figuring out whether this is the real thing or something that we need to work up or something that we can work up as an outpatient. They're quite good at it. And so you need to go in. And what I tell people is if you've had a heart attack before, you're very likely to have the same symptoms again, so don't ignore them. With other folks, I say if you're at risk for a heart attack and you can't explain something, then you need to come in. Don't delay and don't drive yourself. Driving yourself in is a really dangerous thing. If you have a problem on the way in, then now you've had a car accident too. The other thing I would tell you is that the emergency medical teams in the state of Kentucky are excellent. They can make the diagnosis of your heart attack sometimes before you get to the hospital. And that means that your care is going to be very much streamlined. Recently, we saw a woman who had symptoms of dizziness and some chest discomfort. Her daughter was with her, called 911. The EMTs diagnosed the heart attack at the scene, and her artery was open less than an hour later. This is really impressive. She walked out of the hospital feeling quite good. So every link in the chain in the state, and especially here in Lexington, is quite solid.
And if you could speak just a little bit, I don't want to take your spot as moderator here, Paul, but a little bit about the difference between a heart attack and cardiac arrest and how those are two different things.
So a cardiac arrest is associated with loss of consciousness, and the heart stops. It may not stop beating, but it may not provide enough blood to keep the brain going, and so people collapse. And a cardiac arrest is an emergency, 911, and we're very anxious for people in the state of Kentucky to learn CPR because you can save a life with CPR very quickly. And so a heart attack can cause a cardiac arrest, but it may not.
Right.
And strokes can cause cardiac arrest. Other things can cause a cardiac arrest, but heart attacks far and away are the most common cause among Americans. And so the American Heart Association and other organizations have been quite aggressive at trying to get folks to learn the basics of CPR so that you can sustain someone until the emergency medical technicians arrive. When they arrive, they know what to do. They'll take control and do the right thing. Recently, the American Heart Association and a high school student from Henry Clay are sponsoring a bill in the state legislature to teach CPR to high school students, and I think this is just a great thing.
that's fantastic.
It's the process of CPR has become more streamlined over the years. It's become easier to do. The devices to help people learn how to do it have become inexpensive, and so I think it's a no-brainer.
And the ickiness factor of doing the rescue breathing is no longer there as far as the layperson CPR.
Right.
We want hands only, and we want fast and hard right in the middle of the chest at 100 beats per minute to the old tune of Staying Alive, if you will.
We want to drive people to your website. Give it one more time in the last minute, and then Dr. Campbell.
Heart.org
Okay.
is the national website, and you can find our local office through there, and we welcome volunteers. We look forward to working with patients who are survivors and would like to show their passion to help cure this disease in our state. So if folks are out there who would like to give us a call, 278-1632 as well.
Joey, thanks for being a driving force in the heart health of our state and city. And Dr. Campbell, you care. I can tell that you care.
We're
and it's great
passionate.
that you do, and I thank you for saving lives and preventing a lot of bad things from happening.
I appreciate it. Thank you very much.
Thanks for coming in.
Right.
I'm Paul Chartier. Check out the website and take care of your heart during Valentine's month. We'll see you next time.